All right, welcome back to the Elias Macco Show. We're going to head now to Dr. Pascal-André Vendittoli, an orthopedic surgeon who has been working in the private sector since 2021, to talk about some recent moves by Quebec's health minister, Christian Dubé, trying to stop the back and forth between orthopedic surgeons, between the public and the private sector. A lot of orthopedic surgeons not happy with those moves. Dr. Vendittoli, welcome to the program.
Yeah, dear Mr. Marcos, thank you for inviting me.
So tell me what's really going on here, right? You know, and I know some people frustrated with waits for orthopedic surgery have gone the private route, and I know doctors work sometimes in both systems. They go back and forth. What's this all about?
You know, this is not new. I'm doing this opting in and out from the public to the private sector since 2005. Because the public system does not allow surgeons to work full-time. So this is the history of the public healthcare in Quebec. Most surgeons only have 1 day of surgery per week and need to fill the void with something else. All my career, I saw patients with disability, pain, and I had to tell them that because of the inevitability of access to the operating room, my waiting list was 1 to 2 years. I think it's impossible as a surgeon to remain impassive for long. So I decided to redirect my career at the Duval Clinic to do good for the people and fulfill my profession. I believe that all my colleagues that are going to private, it's for the same reason at this moment.
Do you think the health minister is playing with fire here, and that if he forces the issue, that we would see a lot of doctors say, okay, that's it, I won't even go back at times to the public system, I'll stay fully on the private side?
It is possible. You know, it will create some changes. But if we extend the duration for the surgeon to stay in the private when they make the move, I believe that the benefit will be for the patients. You know, currently the public system is so inefficient, the delay is so unacceptable that patients choose the private sector mainly for shorter access. This is not what the private sector should be about. Many private clinics offer short waiting time and recruit a desperate clientele. These private clinics do not offer superior quality to get business. I believe that if the public system is strong, the demand for private service will remain limited. You know, in my practice, I decided to go private because I wanted to offer superior quality of care at our clinic. We do not want to serve on the bad performance of the public system. And I believe that if the government impose this longer period, the surgeon will have to make a choice and then to decide to invest their time to create a superior quality in their private practice, not just being a tourist once per 2 months with a few patients per year.
I was listening to the health minister this week. I was listening to Christian Dubé. And, you know, it seems, you know, what he wants is to find a way to do more surgeries, right? He was going down the list that we're doing 1,000 surgeries a day in Quebec, but we're still not, like, we're canceling 150 a day on top of those 1,000. He's trying to get more surgeries done. And he said that he's open to using the private sector more as long as you don't pay with a credit card, you pay with your RAMQ card. What do you have to say to his end goals and how this health minister is handling getting more surgeries for Quebecers?
Yeah, I think I really enjoy Minister Dubé yesterday when he said these words. I've experienced in other countries seeing the cohabitation between private and public sector very successfully. In the private sector, we are more efficient. We can do simple cases, more cases per day. At the Duval Clinic, we do more than 1,200 hip and knee replacement per year in a small environment with only 60 employees. So we are very efficient. I think that Mr. Dubé understands really the efficiency benefit of the private sector. And one thing that he said yesterday I truly believe that this is the way to go. Patients should not pay the full bill when they go to private. The government needs to take the responsibility. A patient who go to private cannot pay the full bill and then pay his tax in addition. He's paying twice. So I would suggest that the government support the patient who decide to go to private by reimbursing a portion of it. That would be much more fair for the patient.
What do you say to someone, Dr. Vendittoli, who fears that more privatization in healthcare means we end up to a U.S.-style two-tier type of system?
It's very important not to go that path. We need clear rules. We need to have a view of where we want to go in the Quebec environment, in the Canadian healthcare system. And I totally agree that we should not aim for the U.S. healthcare system, which is very costly and not really providing care to the whole population. We need a cohabitation that would be in harmony between the public and private. Private goal should be to offer premium care, something that maybe is not possible in the public system because of the larger team, larger hospital, and the goals of the public system is to handle the complex cases, the severe disease, people who need really specific care like intensive care unit, big surgery, big complications. The private care should focus on simple things very efficiently: cataract surgery, hip and knee replacement, all these things that can be done outside the big hospitals more efficiently and with lower cost.
Dr. Vendittoli, we do have to leave it there. I want to thank you so much for coming on this morning.
Thank you so much.
That's Dr. Pascal-André Vendittoli, orthopedic surgeon, has worked in the private sector since 2021.